question that I chose to hone in on for my evaluation matrix was the effectiveness of aversion therapy in the treatment of alcoholism. And this particular paper sought to fill in the gaps of research papers which had been conducted beforehand. And it at the start, it explains their shortcomings, and it seeks to fill in those gaps by using a robust methodology and sample size. And this therefore led it to having a succinct conclusion towards the end. So it was quite wholesome in terms of its actual research and methodological point of view. And then it was very to the point and exact about its conclusions. So what was the actual point of this paper? As mentioned, there were quite a few reviews that this paper outlines that ran before it did. And what this paper did was to go in and try and fill in those gaps that those papers might have missed out on, or that the reviewees or the researchers for this paper felt that those pieces might have been lacking. As mentioned, this was achieved through its in-depth methodology and its succinct conclusion. The reason I used this paper was to support my hypotheses that yes, aversion therapy, whether it be by shock or by chemical, is effective in alcoholism and treating patients with alcoholic disorders. So this review used 249 inpatients at Schick-Shadel Hospital in Seattle, Washington. And what it did was it matched them against patients from a national treatment outcome registry on a post hoc basis against 17 baseline variables. And this is the CATOR, or the Chemical Abuse Addiction Treatment Outcome Registry. And so, as mentioned, these 249 patients were measured across the initial treatment phase. And then they did follow-up treatments at 1, 3, 6 and 12-month intervals. And at these times they were measured against the National Registry CATOR. And this was a particularly, I suppose, insightful paper to me because there was no discrimination on gender, age, race, sexual orientation or any other sort of identification. The 249 inpatients at Schick-Shadel Hospital were all self-administered, so each patient within this registry, so not administered, was self-admitted, so it was entirely voluntary. The methodology that was used in this review began with a program that had components including detoxification, if necessary, for the inpatients, followed by 10 days of multimodal treatment, which was inclusive of 5 alcohol aversion therapy sessions using sodium pentothal, along with group and individual therapy sessions, and this ran across a 10-day period. Once they had completed this 10-day period, they were then discharged, and in 1 and 3 month intervals, a 2-day reinforcement session was ran, consisting of aversion treatment, again with the sodium pentothal, counselling session, group therapy session, and the patient is prepared for group support sessions post-discharge. Once the patients were discharged after the 1 and 3 month intervals for the 2-day programs, they then filled out forms which helped identify them against a unidentified individual from the CATOR database that was earlier mentioned, and they were matched across 17 different baseline variables to ensure consistency. And what this enabled was predictability of whether the individual patients from the 249 inpatients group, whether they were likely to drop off, what their recovery rates would be like at 6 and 12 month intervals, what their abstinence rates might be like. So it basically helped give a bit of predictive nature around the research that was being conducted. So the results of this paper showed that 16.8%, or 42 of the 249 patients from Schick, were lost to follow-up at the 12-month follow-up point. Amongst this group of dropouts, abstinence from mood-altering chemicals at 6 months was 59.5%, and alcohol alone was 66.7%. From those who did not drop out and did follow up in the 12-month follow-up period, 83% remained abstinent from chemicals and 89% remained abstinent from alcohol. So what these results show is that for those patients that did continue with a follow-up, abstinence from mood-altering chemicals and alcohol was deemed successful, showing that this type of aversion therapy was an effective method of deterrent. While I do feel that this was a highly effective review or research paper, I do think there are a couple of areas which could have been improved upon. And there's mainly 2 points. One is that I feel like the sample size could have been bigger. 249, while it is a decent sample size amount, I think it would have added more credence to the results if the patient size had been in the 500 range. But then again, it is noteworthy that all these patients were self-admitted rather, and it might be a factor that they weren't able to get a large sample size. The second point which stands out to me most is that I feel like the experiment could have been run for a longer period than 12 months from the treatment date. I feel it would be interesting to see if it had stretched maybe across a 5-year period with annual follow-ups, and this could show the longer-term abstinence rates and what relapse rates. This was an effective paper to use for supporting my hypothesis that aversion therapy is effective for alcoholism, because it did show that is true. As mentioned, there are a few downfall points which I think could be improved upon, but I do believe it gives a clear picture of the effectiveness of aversion therapy, and this is why I used it for my evaluation review.